So, before I begin, for those of you who are wondering, no, I'm not related to Deepak Chopra. But I am working on it. In the kind introduction, you heard that I am a pain medicine physician. In reality, I do not treat pain. I treat suffering. The emotional pain of suffering about our health, and all of us here treat suffering. Many years ago, while living in Calcutta, I wanted to do some volunteer work. One day, I walked into what was then called a leprosy home. As I stepped into this place, I saw an older lady quietly spoon-feeding a very sick man. He could barely sit up. Very patiently, she fed him one spoon at a time. After she had fed him, he lay down and she tucked him in. She put her hand on his forehead affectionately and turned around to greet me. I was in the presence of Mother Teresa. Over the next few months, as I worked with her, I learned to get on my hands and knees and wipe the floors, clean the wounds of patients, and give the patients a bath. It was a very humbling experience. That is when I realized that my calling was to become a physician, to alleviate suffering. I learned humility, I learned compassion, and I learned how to scrub floors. Later in my medical studies, I would often see the same frail Mother Teresa come into my hospital with a sick child. It was just amazing to see her dedication and humility. Looking back, I felt that every time I came in contact with her, it added a little bit into my being. It influenced how I look at patients. Try to offer them the same compassion she offered to others. I'm sure she is up there now with us, blessing everyone here for our desire to understand what she devoted her life to. Today, I stand before you as a patient, not as a doctor. We are all patients. If you are not one, then one day you will be. It's an inevitable truth of life. We are blessed that God has given us this opportunity to help others. It is with humility that I accept this calling and treasure it. So should we all. Compassionate care is much more than the science of medicine. It is giving others hope, care, and love. Hope is what we live for. It's what makes us get out of bed every day. In the waiting room, it is every mother's hope that a child will be safe and healthy. Hope is the one thing she brings when she takes a child to a medical facility. Hope that we will have the knowledge, understanding, and care to do our best to help our child. Hope is when we reassure the mother and child that we will go the extra step to help them. Reassure them that we are on this journey together. Hope cannot be prescribed on a small piece of paper for the pharmacy to fill. It is looking into your patient's eyes and making a promise that you will do your best to help them. We may not always have an answer, but we can always offer hope of some kind. So please think out of the box. Seek help on their behalf. Do not let them leave your office without hope. Sometimes words are not enough. A lot can be said with the human touch. The human touch is one of the most reassuring gestures. Just a small touch, even holding someone's hand, reassures them that you are there for them. Care Care is the second word that defines compassion. Compassion is taking the time to listen to all the concerns and answer all the questions. Concerns that are relevant and maybe not so relevant, but still a part of what worries a patient. Care is listening patiently. Listening is part of the healing process. Look into their eyes and connect with them. Please do not stare at your computers and charts. Look into their eyes, smile, and reassure them that you are determined to help them. A quick phone call, a short email to check in on your patient always shows how much you care. The most reassuring feeling a patient can have in knowing that the doctor is thinking of him or her outside of an appointment. Care is a team approach, with every staff member in an office greeting patients with a smile, making them truly welcome and comfortable, and making the office a sanctuary where all patients feel safe. That is why I share the honor of this award with the caring people in my life: Dr. Schneiderman, Cynthia, Melissa, Ina, Lisa, Beth, Cherish, Monica, Rachel, Nell, and my little son, Neil. Love. Love is the driving force of compassion. Love is when we enjoy and cherish the uniqueness that is in every one of God's creatures. I must mention God. I went to a Catholic school, my family is Hindu, I lived in a community of Buddhists, and trained in a Jewish hospital. How could I not have faith? I know. I don't know if there's something called a religious mongrel. Regardless of religion, love is at the core of all human beings. The mother of a sick child knows all too well the power of love in healing. Shouldn't we, as healers, show the same love to others? Love is to share the patient's worries and reassure them that we, as a team, care. So please, do not be dictated by establishment rules of how much time to spend with the patient. An extra few minutes, a home visit, email, or phone call can make all the difference between mere treating and actual healing. Yes, I do visit some of my patients at home. It is one of the most rewarding experiences of my life. Try it. Especially if you show up around supper time. You get to see your patients in their environment and meet their loved ones. It improves outcomes dramatically. Compassionate care is the heart of medicine, and I'm so grateful that the Schwartz Center reminds us of that truth when they educate and inspire us about best practices. That kind of teaching reminds us of why we chose to go into medicine in the first place. Many years ago, William Shakespeare wrote, "The quality of mercy is not strained. It drops as a gentle rain from heaven upon the place beneath. It is twice blessed. It blesses him that gives and him that takes." When the gentle rain falls, it falls on everyone. It blesses all of us at the same time. Compassionate care is like the gentle rain. It blesses those who receive and those who give. Compassion is hope, care, and love. Thank you.